and you have the monitor on your side that you can see that. Then you want to see the ventilator. So the ventilator, you get it from this side so that you see the ventilator movements, you see the monitor, you have the position, right? And the nurse who is assisting, it's always 3-person system, right? So I now need a nurse. Do we have a nurse here? Please come, please come. Please come, please come, please come, please come, please come. So the nurse, she normally, thank you very much. The nurse, she normally stays here because then she can assist, right? She's having everything there and she's assisting from this side, right? But otherwise, for today, you are staying from here. So come there. So, all right, very good. So now I will show you some tips and tricks how to perform it, because this bronchoscope at the ICU, because this is a German made, this is a German quality, this bronchos can last for 10 years at least. Because there are 2-3 things which you have to be very careful of. The one thing is, the bronchoscope, the most sensitive area is here, right? This is the most sensitive area. So if you perform the bronchoscope like this, it's not good, right? Because after 2, 3, 4, 5 years, the build quality will be not good. The reason is not the made of the quality. This is a German brand, so this is the sensitive area. So you always hold the bronchoscope should be like this. This place should be directly. Then it lasts forever. And when the nurse comes, you give the bronchoscope like this, right? You don't give it like this. You give it like this. And the second thing is, or you can give it like this, right? If you want to one hand, you can give it to her like this. So then she takes it like that and can bring her up to the washing, right? So this is the main handling, please, ma'am. So, and the next thing is, this is the lever. With this you control the bronchoscopy, right? Once you go up, the bronchoscope goes down, you see that. And once you go down, the bronchoscope goes up. So this is one movement that you have, right? You have 3 movements. One movement is this or that with the lever. The second movement is going in front or back, intubating, right? Going front or back. And the third movement is the wrist work, like this or that, right? And you don't do this. This is gastroenterology, right? You don't dance with the bronchoscope, right? This is something very elegant. You do the wrist work, right? 1, 2, and 3. These are the only 3 movements. And this is the suction. So you put the suction here. So then with the suction, you operate with the suction channel here. So this is the way to hold the bronchoscope. Okay? So now you show me the movements. Yes? Go down.
Go down.
Yeah. So, other way around? Yes. Do it with more pressure. Yes, absolutely. Once again. Alright. Yes. This is one movement. The second movement is with the other hand, you are holding the bronchoscope on the tip. Like this, right? So, this is one movement. You move both hands, and this is one movement, and the other movement with the lever. Yes. These are the 3 movements. Then we have different sizes of the bronchoscope. The biggest size is the working channel 3.0. Is working channel. There are 2 lights and the chip on the tip and the suction channel, right? So this suction channel, the working channel, which is operated from here, you can put water inside and do the suction there, right? So suction channel, the working channel is 3 millimeters, then the outer diameter is 6 millimeters. Right? If the suction channel is 2.8, The outer diameter is 5.2. This is a middle one, 2.8, outer diameter 5.8. And the pediatric size is 1.2 is the working channel, and outer diameter is 3 to 4 millimeters, depending on the system. So which bronchoscope are you looking for your institution? If the patient, what is the size of the tube, what you normally intubate, sir? Very good, 7.5. But I will advise you to do 8 because it is better to manage the airways with air trapping and everything if you have the 8. But sometimes it's difficult to intubate, then you take 7.5, right? So if you take 7.5, the bronchoscope should be always, to handle it better, 2 millimeters less. That means if you have 7.5, this is 5.2, so this is the correct one. You can take the 6 millimeter with 3 millimeter working channel, but it's a bit roughy. To have the bigger bronchoscope, then you have to intubate with 8. Right? So this you have to always realize, right? 2 millimeters smaller outer diameter. Right? Okay. So these are the specifications. So now I go back once again. You do with the untrained hand, you hold the lever with one, the other finger onto the suction channel. This is the suction channel. This is to amplify the water. This part to keep always straight. With other hand to hold it there. This is one movement, second movement, and the lever movement. Right? This is all the technical stuff what you want to know. Because I make it very simple, this is only thing what you have to learn because I want you to perform it tomorrow. You will be ready tomorrow. Go through the nose. If the patient is not ventilated, we go through the nose because it's easier. Absolutely right. Now she's going inside. And have you ever done the bronchoscopy? Have you ever performed the bronchoscopy already? For intubation. Okay, that's very good. Okay, you carry on. So she's already there. Right? So now we intubate. So just wait there. So this is the trachea. Right? This is the trachea. So your biggest advantage, once you do it from the top head, it's easier for you because this is up, this is back. You see all the cartilage rings, so it is the proper way, right? So you go down very slowly. So now the trachea you got. And she's doing it very good because you always have to have the vision in the middle. With the trachea, this control, you can control that. You always have the picture in the middle, right? So now we wait. Very good. So now you see this is the right side. And this is the left side. Okay? So you see that. So now you've been to the trachea and you have seen the right side and you have seen the left side. Okay? Right. Now you intubate to the right side. Just wait, I will give you a trick. So if you want to go to the right side, you just turn to the right side and yes, absolutely top. So very good, very good. Now you are that's enough for the first time. So this is the right side of the lung. Now you come back and you go to the left side. Absolutely right. Now you are on the left side, right? So come back once again. So she went to the right side, she went to the left side. So on an intubated patient, this is enough for the first step. Because you have gone to the right. So now I will show you something. Can you hold my mic? So if you do the suction without the vision, right? What you normally do is, now you don't see that, right? So look at there what you normally do. If you do the suction only, you just do this. So you are hurting the tracheal system all the time because you do this. This is suction. So now you see how elegantly the suction can be managed, right? So it was very well done, ma'am. So the next one. Please, I will take the mic. So, first get ready with the instrument, yes. You just check it. Absolutely right. And this is the suction. Yeah. Once again down. Go down. Go down. Yeah, and up. Yes. And this is a good hand, right? Okay, now you're ready. Yeah, thank you. Just wait a second. Just wait a second. Cool. Because the video laryngoscope only gives you the inside, but it does not allow you to see the airways, right? So therefore, you don't have the ear, you know. No, that's okay. That's okay. That's okay. That's okay. That's okay. That's no problem. So now we think this patient is very difficult to intubate. Then we don't go through the nose, right? Because now we want to intubate. So then we go through the mouth, right? So we are already there, and then so we intubate. So we have already intubated, right? So the first ever patient, you are doing the bronchoscopy, you do on the intubated patient because it is easy, because the tube is already there, right? Because you did the difficult way, you went through the airways. But first patient, you do the intubated patient, it's easier for you. Now, as an example, have you ever performed the bronchoscopy?
Long time ago.
Long time ago. So this is good. You are doing it for the first time now on the ventilated patient after years, right? So now you get familiar with and you try to intubate. Can you please hold? That's very good. Thank you. Just give me a second. So okay, now you carry on. So you intubate. All right. Well done. So you go inside. 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 You go to the right side now. Try to go to the right side. Try to go to, yeah, well done. She's having a brilliant picture. You all are very talented, everybody. So you do the suction a couple of times. Suction a couple of times. So now you go to the left side. Go to the left side. Yes. Doesn't matter. So you go there. I will show you. You just turn this way. You go there, and with the lever, with this lever, you do this. Then you can intubate, right? And then you have to manage the picture. You have to manage the, yeah, absolutely. Then you do the suction. Do the suction, all right. Do the suction, do the suction. Now come back. So come out. It took only 50 seconds for her. Right? I mean, doing it for the first time, just going without, doing it proper correctly, she did it in 50 seconds. So you see how much time you have. Right? You have enough time. Now you come once again. So you come once again. You go inside. Your second time now. So now I will give you 60 seconds so that you have a feeling how long you have. Right? 30 seconds on the right side.
Go to the right side and then to the
left side and come back. You have 1 minute time. Right? So wait. We start now. Yes, go inside, go inside, go inside. All right. Do the suction. Do the suction. Do the suction. Do the suction. You are 12 seconds. Just wait. You have more time. Do the suction. You go deeper. You go deep. Do the suction. 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 Now you go to the other side. To left side. Come back. Come back. Come back. Come back. Come back, come back, come back, come back, come back, come back, go to the left side. So go inside, yes, well done. Do the suction, 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 do the suction. Now you come back, come out. Come out. So this is 56 seconds. Now you just realize how much time you have. So with any patient with P10, 12, 8, 7 or IPAPs 20, 25, 30, you can do because it's a matter of just doing the suction. Right. So now we do the suction without vision. We go inside. We are not controlling the don't control the bronchoscope. We do the suction. This is the suction that we do. So therefore, you can get the patient controlled. You can have a good vision, and both of you are ready to do the bronchoscopy tomorrow on the ventilated patient. I have no matter about that. So now we get the next one. Please come, sir. Go to the right side. Well done. Go to the right side, okay? Come back. Go to the left side. Okay, and you come back. So we do the anatomy step by step, right? So now I will give you 1 minute, right? So you see the time. Right, yes, do the suction. 13 seconds, 15, you have time. Do the suction. See how many time you have. See how much of time you have. See how much time you have. Now you go to the left side. So do the suction. And come back. So it took only 50 seconds for you. So everybody is ready for this. Everybody is ready to go to the right side, go to the left side. Now as an example, he realized there are more secretion on the right side. So the next time, he just want to go to the right side, as an example. So now you ventilate the patient, you get the ventilation saturation to 100%. Now you go to right side only, right? Now we think we just want to go to the right side, you go to the right side. Okay, all right, stop. Only to the right side and you do the suction, right? On the ventilated patient. So now you have 1 minute time. See how much time you have. You can do the suction very easily. So now you have to concentrate, When you do this, it's not good, right? You have to keep it like this, so then you have the bronchoscopy for 10 years or 15 years. Till the day you retire. Right? So when you do the suction, you do a movement of 1 centimeter up and down. 1 centimeter up and down. So because the suction power increases, up and down 1 centimeter, not more, like that. Move it. Yes, like that. Small movements up and down. Look, it is 45 seconds. Now you can come out. You have lot of time. Sometimes when we see it's 45 seconds or 60 seconds, we think, oh, very short time. But when you are in the airways, it's enough time for you. It's enough time for you. Okay. So, now we want to do the anatomy. Now we go through the anatomy. Now we went to the right side, we went to the left side, upper lobe, the middle lobe and the lower lobe of the right side, and the upper lobe and the lower lobe of the left side. That is all what you have to know. Nothing else. Only the upper lobe, middle lobe, lower lobe, upper lobe and lower lobe. This is the anatomy which you have to master. Nothing else. Alright, now we go. Please do. To the right side, yes. This is the upper lobe. Where you are watching now is the upper lobe. So you go there, it is the upper lobe. Try to intubate. It is the most difficult area. Well done. Now you are in the upper lobe. This is the upper lobe of the right side. So you come back and you go down. Intermedius, right? Wait. You go down. That's fine. When you are there, which is here, the upper one, is the middle lobe. You go there. Well done. That is middle lobe. Come back. Every other thing is lower lobe. That and here. And there is also one. Everything else is lower lobe. You don't have to know about the segments. It's enough for you to know the upper lobe, middle lobe, lower lobe. Because you are just managing the airways. You are just making the secret management. That's all, right? So you go to the left side now. Go inside, So when you are there, right? Just when you go inside, just wait. So when you go inside like here, upper lobe, go there. This is upper lobe, everything is upper lobe, little neck, everything is lower lobe. So this is all what you have to know. Going to the left side, right side, upper lobe, middle lobe, lower lobe, going to the left side, upper lobe, lower. This is very uncomplicated. 60 seconds, you have to see the 3 segments of the right side, 2 segments, 2 lobes of the left side. That's all what you have to do. Nothing else. This is airway management. This is ICU point of care bronchoscopy. Nothing else, right? Well done. Somebody else? Please, come sir. Well done. Well done. Well done. Okay, carry on. Okay, come back. So go to the lower part, is well done. This is middle lobe, right? You go to the middle lobe, well done. Come back. Go to the lower lobe, well done. Finish this side, of the other side. Go to the left side, well done. You're really good. Go inside, go inside, go inside. Upper lobe, well done. And show me the lower lobe. Yes, all right. There is something inside, we can catch it later on. So you come back. So within 58 seconds, he went to the right side, went to the left side, went through the upper, middle, lower lobe, upper and lower lobe, left side, and done. Right?